Everything you need to know about high cholesterol. High cholesterol is a common health concern. According to the Centers for Disease Control and Prevention (CDC), nearly 86 million U.S. adults aged 20 or older have cholesterol levels above 200 mg per deciliter, mg/dl. High total cholesterol is generally considered anything over 240 mg per deciliter. The challenge with high cholesterol, also known as hyperlipidemia or dyslipidemia, is that it often shows no symptoms. Many individuals are unaware they have high cholesterol until a routine blood test reveals elevated levels. What is cholesterol? Cholesterol is a waxy, fat-like substance produced by the liver. It plays a crucial role in the body, including the formation of cell membranes, certain hormones, vitamin D. Cholesterol does not dissolve in blood, so it travels through the body attached to proteins called lipoproteins. These lipoproteins carry cholesterol and triglycerides, another type of lipid, throughout the bloodstream. The two primary types of lipoproteins are low-density lipoprotein, LDL, often referred to as bad cholesterol. High levels of LDL cholesterol can increase the risk of heart disease and stroke. High-density lipoprotein, HDL, known as good cholesterol. HDL helps remove excess cholesterol from the bloodstream, reducing cardiovascular risk. Symptoms of high cholesterol. High cholesterol is often called a silent condition because it usually does not cause noticeable symptoms. Many people only discover they have high cholesterol after developing serious complications, such as heart attacks or strokes. Regular cholesterol screenings are essential, especially for adults aged 20 and older. Consult your doctor to determine how often you should check your cholesterol levels and discuss strategies for managing high cholesterol effectively. Causes and risk factors of high cholesterol. High cholesterol develops due to a combination of lifestyle, genetic, and medical factors. Consuming foods high in cholesterol, saturated fats, and trans fats can increase your risk of developing high cholesterol. Being overweight or obese also contributes to elevated cholesterol levels. Other lifestyle factors, such as physical inactivity and smoking, can further raise your risk. Genetics play a role as well. Familial hypercholesterolemia, an inherited disorder that prevents the body from effectively removing LDL cholesterol, is a less common cause but can lead to total cholesterol levels above 240 mg per deciliter and LDL levels above 190 mg per deciliter. Certain medical conditions, including diabetes and hypothyroidism, can also increase the likelihood of high cholesterol and related complications. High cholesterol can affect people of all ages, sexes, and ethnicities. While some risk factors cannot be changed, there are effective strategies to reduce your overall risk. LDL cholesterol versus HDL cholesterol versus triglycerides. Understanding the differences between LDL, HDL, and triglycerides is crucial for managing high cholesterol. LDL bad cholesterol. LDL cholesterol carries cholesterol to the arteries. High levels of LDL can lead to plaque buildup in the arterial walls, a condition known as atherosclerosis. This can narrow arteries, restrict blood flow, and increase the risk of blood clots. If a clot blocks an artery in the heart or brain, it can result in a heart attack or stroke. High LDL levels may also cause bile imbalances, raising the risk of gallstones. Atherosclerosis can lead to serious health complications including stroke, heart attack, angina, chest pain, high blood pressure, peripheral vascular disease, chronic kidney disease. HDL good cholesterol. HDL cholesterol works to remove excess cholesterol from the bloodstream by transporting it back to the liver for elimination. Higher HDL levels help prevent plaque buildup, lowering your risk of blood clots, heart disease, and stroke. Triglycerides. Triglycerides are another type of lipid that the body uses for energy. When you consume more calories than your body can use immediately, the excess is converted into triglycerides and stored in fat cells. High triglyceride levels, often caused by overeating or excess calorie intake, can raise the risk of heart disease and stroke. Doctors measure LDL, HDL, and triglyceride levels through a blood test to assess your overall cholesterol profile and cardiovascular risk. Regular testing is a key part of monitoring and managing high cholesterol. Cholesterol testing and optimal levels. Regular cholesterol testing is essential for maintaining cardiovascular health. The CDC recommends that most adults have their cholesterol checked every 4 to 6 years. However, if you have a family history of high cholesterol or other risk factors for heart disease, your doctor may recommend more frequent testing. Cholesterol is measured using a lipid panel which evaluates total cholesterol, which includes both LDL and HDL. LDL cholesterol, often referred to as bad cholesterol. HDL cholesterol, known as good cholesterol. Triglycerides. High cholesterol is diagnosed when total or LDL cholesterol levels are elevated, especially when LDL levels are high and HDL levels are low. Your doctor will interpret these results along with other health factors to determine your risk and treatment plan. Optimal cholesterol levels. For most adults, the CDC defines optimal cholesterol levels as total cholesterol, about 150 mg per deciliter. LDL cholesterol, about 100 mg per deciliter. HDL cholesterol, at least 40 mg per deciliter in men and 50 mg per deciliter in women. Triglycerides, less than 150 mg per deciliter. LDL cholesterol can be further categorized. Below 100 mg per deciliter, optimal. 100 to 129 mg/dl, near or above optimal. 130 to 159 mg/dl, borderline high. 160 to 189 mg/dl, high. 190 mg per deciliter or above, very high. These numbers serve as a general guideline, and your doctor will consider your overall health before recommending treatment. How to lower high cholesterol. Managing high cholesterol often starts with lifestyle changes, and medications may be added if necessary. Dietary changes. A heart-healthy diet is central to controlling high cholesterol. Recommendations include limiting foods high in cholesterol, saturated fats, and trans fats. Choosing lean proteins such as chicken, fish, and legumes. Eating high-fiber foods including fruits, vegetables, and whole grains. Preferring cooking methods like baking, broiling, steaming, grilling, or roasting. Avoiding sugary, ultra-processed, and deep-fried foods. Common foods to reduce or avoid include red meat, organ meats, egg yolks, high-fat dairy, fried foods, certain baked goods, and ultra-processed items made with cocoa butter or palm oil. Incorporating foods rich in omega-3 fatty acids such as fatty fish may help lower LDL cholesterol and support heart health. Medications for high cholesterol. Not all individuals with high cholesterol require medication. Doctors may prescribe drugs if lifestyle changes alone are insufficient. The most commonly prescribed medications are statins, which reduce the liver's cholesterol production. Examples include atorvastatin Lipitor, pravastatin Lescal, rosuvastatin Crestor, simvastatin Zocor. Other medications may include niacin, bile acid resins such as cholecyvalum, Welchol, Colestipol, Colestit, or cholestyramine, Prevolite. Cholesterol absorption inhibitors, such as ezetimibe, Zetia. PCSK9 inhibitors such as alirocumab, Praluent, and evolocumab, Repatha. Combination drugs like ezetimibe with simvastatin, Vitarin, can help both reduce dietary cholesterol absorption and limit liver cholesterol production. Home remedies for high cholesterol. For some people, high cholesterol can be managed without medications. Lifestyle changes such as maintaining a nutritious diet, engaging in regular physical activity, and avoiding tobacco use may be enough to improve cholesterol levels. Certain herbal and nutritional supplements are sometimes promoted for lowering cholesterol. These include garlic, hawthorn, astragalus, red yeast rice, plant sterols and stanols, blonde psyllium from psyllium seed husk, ground flaxseed. The scientific evidence supporting these supplements is limited. The Food and Drug Administration (FDA) has not approved any of them as treatments for high cholesterol. Before using any supplements, consult a healthcare professional, as they may interact with other medications or treatments. Preventing high cholesterol. Although you cannot change genetic risk factors, you can reduce your risk of developing high cholesterol through lifestyle management. Effective prevention strategies include eating a heart-healthy diet that is low in cholesterol and saturated fats and high in fiber, limiting alcohol consumption, maintaining a healthy weight, exercising regularly, avoiding tobacco use or participating in a smoking cessation program, following your doctor's guidance on routine cholesterol testing, especially if you are at higher risk for coronary heart disease. Takeaway. High cholesterol often presents without symptoms, which is why regular testing and proactive management are critical. Untreated high cholesterol can lead to serious complications, including heart disease, stroke, and other cardiovascular conditions. Healthcare professionals can help you monitor and manage high cholesterol levels effectively. Lifestyle interventions such as nutritious eating, regular exercise, and avoiding smoking play a vital role in maintaining healthy cholesterol and overall heart health. For more trusted, science-backed information on high cholesterol and other health topics, subscribe to the HeInfo channel, your all-in-one destination for reliable guidance on managing your health.